We're joining two senior consultants discussing life as an anaesthetist and paediatrician. They're Dr Hazel Adams and Dr Peter Martin from KSS Deanery. You know, I start by asking you both, what are the characteristics of a really good specialist in your field? Dr Adams, Hazel, perhaps I can turn to you first.
I think the first thing that probably applies to all doctors is that we love medicine. Anaesthetists are practical, and a very important characteristic of an anaesthetist is said to be that they have eyes in the back of their head. As we're in theatre, we have to understand the mood and the tensions within theatre, and we have to be listening to how fast the sucker bottle fills, and at the same time have an ear on conversations about what's going on outside of theatre. We have to be very good communicators, and again I'm sure that Peter will say that paediatricians, all doctors, have to be good communicators. Within anaesthesia there are very particular requirements, and that is that we have to be able to communicate, of course, with patients and their relatives, but with almost every other group of people who's working in the hospital, and to be able to summarise quickly and clearly is absolutely fundamental.
I would agree with that. And I think also you mentioned that, you know, every day is different, isn't it? You don't come to work every day and just think, right, it's a routine day. Anything can happen on any day, you know, whether you're working in anaesthetics, in paediatrics, in community paediatrics, on the neonatal unit, etc. And I think it's that change every day. The thing is in what's going to happen today, which is interesting. I think in paediatrics, it's being part of a team, being able to talk. You actually have two levels of communication when you see a patient. You've got to talk to the patient if they're old enough to talk to. You also have to talk to their parents as well. It's being able to switch from talking to, in effect, other adults who are very concerned about the well-being of their child or their baby, and then, where appropriate, getting down to the level of the child and using appropriate terminology and language so that they can understand that. Also, paediatrics, as Hazel's already stated, in anaesthetics, team working is vitally important. It's not just the doctors, it's the midwives, it's the nurses, it's the dietitian, the radiographers, the GPs, the specialist nurses, etc. There's so many people, and we work together as a team. It's not just the doctors and everybody else, it's the doctors just part of the multidisciplinary team. And I think that is very important. What makes it so interesting and so enjoyable? I think the other thing as well is the fact that most paediatricians working in teams, they're almost a group of friends. We work together, we're colleagues, we're friends, we enjoy it, and you actually come to work wanting to come to work every day.
What are the recent developments and hot topics in your areas? What keeps your interest and enthusiasm going over the years?
I don't know about Hazel, but certainly within paediatrics you've got the idea that neonatal intensive care has changed out of all recognition over the last 10 years. A lot more non-invasive ventilation we use now, which is good for the babies. We've got the use of nitric oxide now, which is a way of being able to oxygenate the babies better. We've got cooling now for babies who are born in very poor conditions. We've also got, I think, something else for what both of us do, which is there's a lot more hands-on for consultants now on the ward, on the units, in theatre, rather than just letting the poor trainee deal with the most difficult patients. We now, most of us will run in institutions whereby when we are working with the patients, we don't have other commitments. You know, that is it, that is our commitment. We're not trying to be in two places at once. Would you agree with that?
Definitely. I think in anaesthesia we've had the same developments in intensive care that you've mentioned, but the role of the anaesthetist has expanded enormously. If I think back to when I started, and I think that we had fairly basic anaesthetic machines and fairly basic drugs, and of course all that's changed. And perhaps partly because of that, the anaesthetist now is ever increasingly pivotal in the whole perioperative care of the patient, so that we see the patients beforehand in pre-op clinics, liaise with the GPs, and then again the post-operative care. Patients are sicker nowadays in hospital because patients are discharged so much more quickly, so those that are in need much, much more care, and the anaesthetist is central to that.
You have a lot more subspecialisation there as well, don't you, in anaesthetics nowadays?
We certainly do, yes.
Looking at the people that come forward into your specialties, would you like more people to come forward? Are you seeing enough?
I think we both agree that paediatrics and anaesthetics are subjects which the medical student do not get a lot of experience in. I know when I was a medical student I got 12 weeks of paediatrics, but I think most medical students now get very much less than that. And certainly anaesthetics, I don't think it's changed. It's a couple of weeks if you're lucky.
Mostly,
And
yes.
I think, yes, we would like people to come forward, but we'd like people to come forward in our specialties with knowledge about the specialty. I think, you know, getting that 2 weeks in anaesthetics is really, if they've had a bad 2 weeks, then they may not apply to anaesthetics, but maybe they need to find out a little bit more information about it. But yes, if people want to do the specialty and know about the specialty, of course we'd like people to apply. I think sometimes people don't apply because they haven't done a little bit of homework first, found out a little bit more about the specialty, and therefore go off down another route which in the future they might regret.
I'm interested in what makes your specialties really good careers, particularly around the opportunities for a bit of variety and individual flexibility in what people do.
Well, in paediatrics we have a large, diverse group of trainees, but we do have a lot of women in paediatrics, and therefore for many years we've accommodated less than full-time training, and therefore certainly any female graduates who are thinking of applying to paediatrics, I don't think they should be put off by the fact that, you know, they may want to go off and have a family, etc. It's really important to know that, you know, all deaneries around the country do accommodate less than full-time training, and have done, and they've actually got good processes in place to allow that to happen, so that they can have a nice work-lifetime balance. So I think just the opportunity to work in a team, to enjoy coming to work, to know that in the majority of cases, in fact I would say the large majority of cases, we make our patients better. And so there is, you know, you can see what either a premature baby or an ill child or a difficult child in the community, eventually we can make a difference.
How about you, Hazel?
I'd echo all of those things. Great team working in anaesthetics, lots of opportunities to work flexibly. I did almost all of my training flexibly some 30 years ago. It worked for me and it works for others. I think Peter's point about the making people better is a really important one. Having the chance to do everything really, really well, to do things as best as you can, and that's very important in anaesthetics because things go wrong quite quickly. The opportunity to work within the team with everybody who loves their job, consultants who are near to retirement as I am, I still find it fascinating and love it.
I think if the team enjoy their job,
Yes.
they work together, and
Yes.
it's for the good outcome of patients.
Yeah.
Thank you. Now it's clear that you both love your jobs, and thank you very much for sharing your coffee break with Medical Careers. And for the viewers, here are some tips and suggestions to help them find out some more.